Can you be too old for a facelift?
Throughout my training and much of my career, I considered the facelift in conjunction with eyelid surgery to be the ultimate solution for facial rejuvenation. In my practice, I developed my own techniques and systems to achieve optimal results with local anesthesia and light IV sedation with quicker recovery than traditional surgery. My facelift patients have ranged from age 37 to age 87. When I'm asked the question, can you be too old for a facelift? It makes me think first about whether a facelift is the best option for what the patient wants, and would the results be worth the investment in time, money, and recovery. I'll discuss how I consider the option of facelift for my patients in my practice and how age is factored into this discussion. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I perform all types of facelift procedures in my practice, from short scar mini lifts to deep plane facelifts. If we look into the past at the options to address facial aging where the skin and soft tissue sagged, resulting in jowls and loose neck skin, it makes sense to operate in order to lift and reposition the sagging tissue. It should also be recognized that there has been a wide range of proposed best facelift surgery options, from minimally aggressive to highly aggressive in our field. Attending medical conferences has been unintentionally amusing for me, as colleagues passionately advocate procedures at one time, and then years later they abandon the same procedures they advocated for so passionately. So what happened? What happened was that regardless of technique, there have always been challenges with facelifting in terms of complications and long-term benefit. The ideal procedure is one that is safe and predictable with minimal complications. Interestingly, I've observed several of my senior colleagues evolve their surgical approaches such that they look very similar to what I advocated for years ago. I think it's reasonable to conclude that they came to the same conclusion I did about safety and predictability. In my opinion, one of the core limitations of any facelift procedure is the bone volume loss associated with facial aging. The pillars of the face which define the facial structure include the cheekbones, the chin, jawline, and jaw angle. In a facelift operation, the more defined these structures are preoperatively, the better the facelift results are. This means that for people whose facial structure are not as strong preoperatively, within a relatively short period of time, they often look like they still need a facelift. Being aware of this variable, I often advocated for the placement of cheek and chin implants at the same time I performed facelift surgery, but many patients were not comfortable with having facial implants. Many were okay with getting a chin implant. Another variable is the quality of the skin, the fatty layer under the skin, and the SMAS, or the superficial musculoaponeurotic system, which is often referred to as the muscle, and needs to be addressed to do a proper facelift. The SMAS is actually a layer of tissue connecting the underlying facial muscles to the skin. If these tissues are thin or fragile, the facelift procedure may not come out as well as the patient would like. I make a point to communicate with my patients about these issues so they can make an informed decision when considering a facelift. Patients often come in for facelift surgery because they feel that their face is drooping when they look at the mirror and when they push their face upwards with their hands. They conclude that they look better. Others come in to have a facelift because they don't want to have fillers and just want to get that one procedure that'll keep them looking good forever. I look at my patient during consultation to determine what aspect of facial aging is dominating in their situation. Is their facial aging issues caused more by bone volume loss or by facial soft tissue sagging, or is it a combination of both? I look at facial aging from the inside outwards, which means I look at the bone structure as the foundation. If there is no significant sagging, I recommend volumizing of the bone structure, but instead of facial implants, I recommend long-lasting hyaluronic acid fillers such as Juvederm Ultra Plus or Juvederm Voluma. Instead of performing surgery, I use blunt cannulas to place volume at the bone structure level in my exam room. Within a few minutes, they appear to look as if they had a facelift. This is not the overused and inaccurate term liquid facelift. I'm using the principles I know from performing facial implant surgery for the placement of thicker hyaluronic acid fillers at the bone level, typically with no bruising and minimal swelling. If the soft tissue sagging is so advanced that the filler placement would not have a significant impact, I recommend facelift surgery. But I explain to the patient that they will still need structural volumizing to address their bone loss after they've healed to get the best results. I do in some situations perform a combination of facelift with structural volumizing at the same time. A facelift is part of an overall facial rejuvenation plan and is not the definitive final step. This awareness of the challenges of lifting sagging tissue over diminished bone structure makes me particularly disheartened by the claims made by advocates of threads and thermal energy devices. I make more of an impact with structural volumizing in a matter of minutes than any thermal energy device or thread lifting procedure where patients are told to wait for months to see the benefit of their treatment, which still don't come close to being comparable to what I do. In evaluating a candidate for facelift surgery, I look at age as a variable from a perspective of physical health, bone structure, and tissue quality. I mentioned earlier my oldest facelift patient being 87 years old when I did her surgery. She was physically strong, had no medical issues, no medications, and she was healthier than people decades younger than her. Her bone structure and tissue quality was great. As I do for any patient, I look at the face as a whole and provide my patient with a detailed understanding of all the aspects of the face contributing to them looking not as good as they can. This includes their eyebrows, upper eyelids, lower eyelids, cheekbones, chin, jawline, and jaw angle, as well as the lips and the area around the mouth. Of course, I look for the presence of jowls and sagging neck skin. I suggest a strategy based on what I feel will be the most impactful for their situation. I find that it's often the case that people focus on something they don't like, such as their neck skin sagging, and then they lose perspective of the areas of the face that are more significant during social interaction. I call this area of social interaction the beauty triangle, which includes the brows, eyes, cheekbones, lips, and chin. It's by no accident that the cosmetic industry creates countless products to enhance these areas. In summary, age is a factor for a facelift in the context of health, bone structure, and tissue quality. Most important is to determine what is the best approach to help you look your best with the lowest risk, minimal downtime, and the most benefit. I hope you found this information helpful. Thank you for your question.